Katie Hornberger, and I'm the director of the Office of Clients' Rights Advocacy, which is a unit of Disability Rights California. We supply the clients' rights advocates for all 21 of the regional centers, and we also have clients' rights advocates working with people in restrictive settings like developmental centers and institutes for mental disease. And with us today is Brittany Gillespie, who is our brand new clients' rights advocate for clients of Alta California Regional Center. So just like Brittany, we have a Brittany everywhere in the state. So for many of you may know your local clients' rights advocate in your area. If you don't, come talk to me and I will help you find out who that person is and how you can connect with them. Sewing is not here, and Sewing is one of our staff attorneys in our federally funded program. And the reason that Sewing's not here is because her mother is ill. Sewing's family immigrated from Vietnam when she was a little girl, and her parents do not speak English. And so as her mother had a medical emergency and they're having to access the healthcare system, she has to stay at the hospital and interpret for her mom. And I think that is really sort of telling about our system, where despite the diversity in the state of California, we still have a system where if you don't speak English, your safety in a hospital is at risk unless you have a family member who can stay with you and provide that translation and interpretation for you. So Sewing is at the hospital with her mom instead of with us, and definitely where she needs to be today. So I'm going to start with the Lanterman Act. Many of you are familiar with the Lanterman Act. I'm a nerd. I'll just throw that out freely. So for me, a fun evening is, reading code sections. But I have to tell you, part of why that's fun is the Lanterman Act is a really good law. It is so amazing, and we are so lucky here in California to have the regional center system and to have codified in our laws very clear language about the rights of people with developmental disabilities. Most states don't have a regional center system. Most states don't even very clearly identify the rights of people with developmental disabilities. Yet here in California, we have a whole section of the law that is all about the individual rights of people with disabilities and their service entitlement rights. We are the only state in the nation that has an entitlement program. What that means is if you need the service, you get it. We don't have waiting lists in California. Many states, if you have autism or cerebral palsy and you need a service, they have a limited amount of those services and you get put on a waiting list for it. Not true in California. You need it, you get it. That's an entitlement program. So it's a really wonderful law, and I do encourage people to read it because throughout the law, they talk about people leading the most productive lives possible, the most independent lives possible. Isn't that wonderful language? Isn't that what we want as human beings? We want to be independent and productive and lead fulfilling lives. That's what I want for everyone, whether they have a disability or not. But the fact that we've codified that goal into law is really impressive to me. So how do we do that? We want people to be independent and productive. We need to provide them the supports and services that they need to do that. That's what the Lanterman Act does. It establishes the regional centers who provide case management to people with developmental disabilities and can purchase services to fulfill the goals of the IPP, the Individualized Program Plan. So most people are more familiar with IEPs. So when we think the regional center is going to provide case management for people, and they're going to do that through the IPP. The IPP is very comparable to the IEP, your document with your school. That's your contract for services, and it's structured based on strengths, areas for improvement, you develop goals, and then you figure out what services are needed to achieve those goals. Same process in the IPP process with regional center. So you meet with the regional center, you talk about strengths, areas for improvement, you develop goals, and then you figure out what services that you need to meet those goals. And sometimes those services are provided by generic agencies, things like special education, in-home support services, Medi-Cal. Other times there are things that the regional center needs to buy for that child or family. And when they need to purchase them, they will actually purchase services also. One of the big goals of the Lanterman Act is to keep children in the family home where that's the desired goal. And the language in that section of the law is really wonderful, and it really talks about doing everything necessary to keep a child in the family home. And for people like me in the advocacy community, I use that a lot because it can be very difficult if raising a child with a disability and balancing all of those demands on your time to do that at home without sufficient supports. And so families often need a lot of supports brought in so that they can keep their child at home. And this is a real think about, 50 years ago, our goal was not to keep children at home. I mean, families were told often when their children were diagnosed, at diagnosis, put your child in a state institution, forget you ever had them. I came from one of those families. My cousin was born in New Mexico with Down syndrome, and his family was told to put him in the state institution. I am not the first in my family to be a little bit of a rebel, and so his grandma said, no grandson of mine is going to a state institution, and she told his folks, if you can't raise him, I will. And they kept him home, and when it was time for him to go to school, the local school district said, oh no, we don't have anything for him. And she was a very prominent school teacher in the area, and this is pretty rural New Mexico. And she said, fine, then I'll quit and stay home and take care of him. And they said, oh, Ann, you can't quit. She said, then let my grandson come to school. And they said, well, okay. So really a big paradigm shift from put your child away, forget you ever had them, to keep your child at home, and we're going to put all the support in that you need to do that. Really a huge paradigm shift with the Lanterman Act. And we want people to be integrated into typical community life. That's our goal, right? We don't want people in segregated programs. We want them integrated in their local communities. So you guys are thinking, okay, so this lady's told us a lot about the Lanterman Act, but this thing was supposed to be about purchase of service disparities, right? I wanted you guys to sort of have a framework. So what has happened, that's sort of our framework. That's how the Lanterman Act works. And what we saw through some studies done about 15 years ago by Dr. Charlene Harrington is that when you look at those services that children receive, children and adults with developmental disabilities, they vary quite a bit by race. And so there were a handful of studies done around 15 years ago. They tried to introduce legislation. Honestly, it went nowhere. I think for a variety of reasons, the community was not really ready to hear that. And then in December of 2011, the Los Angeles Times published a series of 4 articles. I'm originally from LA. I've only been up north a couple of years. So I was in LA and practicing when these articles came out. And it really caught at the right moment in time, I think, for a number of reasons. And in this series of 4 articles, they really focused on children with autism. And the first article was really about autism in general, sort of defining what's autism, what's going on in the autism movement. The second article was actually, it was entitled, Services Go to Those Who Fight the Hardest. And what they did in that article is they did a Public Records Act request from the Department of Developmental Services that funds all 21 regional centers, and they compared the data. They compared it by race, and then they also compared it by regional center. And what they found was really quite shocking to people. And why it was shocking is, I'm going to tell you guys some numbers, and so for those of you not good at numbers, I'll go slow. So white children with autism, statewide on average, we're getting $11,723 of services per year. Asian children of the same age group, same diagnosis, $11,063. Doesn't sound too bad, right? Like, you know, people have different needs, right? It's a few dollars. What do you think about Latino children with autism? Higher, lower, what are you thinking? Okay, it was not that bad. So I'm glad you lowered the bar for us. So this is not going to sound as shocking now because she did lower the bar for us. So Latino children, 7,634. So if I have a Latino child with autism, I'm going to get, $7,500 worth of services. White child, same diagnosis, they're going to get more than 11,000. Well, I mean, most of us here know that the effects, particularly around early intervention, services matter. And so by getting this significantly lower amount, it was really troubling. African American children with autism fared even worse when you looked at them statewide, $6,593. They're getting half of what a white child with a similar diagnosis was getting when you looked at children statewide. I mean, it really was shocking. And when you look at the demographics of California, as our population is changing, those numbers are even sort of what I would consider to be more wrong. And then they also pulled the statistics regional center to regional center. So if I live here in Sacramento, I'm a client of Alta, you'd think I'd get about the same amount of money spent on me as if I lived in Orange County, right? No, not at all. Not at all. And remember, this article was published in the Los Angeles Times. The low end was South Central Los Angeles Regional Center, which is 98% African American and Latino. Children ages 3 to 6, we're really talking about a core time in child's development when we think about service needs. They were spending $1,991 per child. And then the state high, county next door, Orange County, Regional Center of Orange County, children with autism ages 3 to 6, they were spending $18,356. So if I live in South Central Los Angeles, I get $2,000 a year worth of services. I move to Orange County, across the county line, now I get almost $19,000. It really was just appalling, and the community really rallied around these numbers. So as much as it didn't sort of generate the outrage 15 years ago, it really did in 2011. And so what happened as a result of those news articles is Senator Darrell Steinberg actually called the Select Committee on Autism and Related Disorders, and in that committee, he formed the Equity and Diversity Committee. They held a public hearing on April 30th of 2012, and people testified, and families came forward and talked about their experience trying to access services and how it wasn't working for them. And so the task force was formed with people from all sorts of disciplines coming together to talk about how are we going to provide services to children with autism effectively and efficiently across communities. How are we going to start bridging these numbers and getting them closer together? They actually published a report at the end of 2012, and I will tell you the report actually has lots of good ideas in it, some of which we're going to talk about in changes to the law have been implemented. I will tell you many of which still remain unimplemented almost 3 years later. So there is still work to be done, so you're all going to leave with homework assignments. Some of those sort of good ideas that came out of the Equity and Diversity Committee include some things that I have a feeling some of you are going to be like, that's not in the law yet. I think you're going to be surprised by some of this. They actually think that families should have meetings and documents in their preferred language. That was not in the law in 2012. Just to recap where we were, the law did not require either of those things. And the committee thought that would be a good start. They also thought that it would be helpful for families to have information about the services that were available and their appeal rights. Those were not required in the law. They thought that it would be helpful for families to get a copy of their IPP within 30 days of their meeting. That was not required in the law. And think about, how many of us, you go to an IEP, you leave with a document in your hand. Your IPP with Regional Center, which is very much the equivalent, the law did not require that you left with a copy of it in your hand. They recommended that there be proposed start dates for services so that when services were agreed to, families knew when they were supposed to begin. They recommended having more flexibility in services so that people could have access to services after hours and on weekends. If your child needs in-home behavioral services, but the therapist can only come Monday through Friday until 5 and you work, well, that service isn't very helpful to you, is it? So increasing flexibility. They also talked a lot about regional centers having strategic plans about how they were going to meet the cultural and linguistic needs of their communities. It talked about when they were trying to recruit vendors to provide services, including cultural and linguistic competencies in those proposals to ensure that the people delivering the services understood how to meet the cultural and linguistic needs of the local community. It called for having advisory boards at each regional center to address the disparity issues and coming up with plans to reduce the disparity and to look at how to provide culturally appropriate services. It also called for data collection. We had some numbers, but let's really look at the numbers and see to really figure out where we are. And the list went on and on. It's a 130-page report. And so this report was issued. They had hearings on the report. And some things did change. We got some changes in the law that I think were very positive. The first change came. It was effective January 1st of 2012, and it was really a direct pull from that report. And what it called for was regional centers to compile data. And some of you may have seen this data. You may have attended stakeholder meeting presentations of the data in your local regional centers, but it called for regional centers to compile data and post it and make it available to people. And so the idea was, let's start this conversation and start it at a local level and have some data to really know what we're talking about. It also called for the department and the regional centers to post that data on their websites and to have a stakeholder meeting to review the data with the community and to talk about what could this mean? Are there things we need to do differently? Are we satisfied with the data? And when we think about how that helped our community, I think it got people talking, which was really important. And because I think for underserved communities, they often don't know their rights, and people aren't thinking about them as a distinct need community. And it really, I think this was a good first step to really getting us talking about traditionally underserved communities and what we needed to do differently as a system. And then the law was expanded. Because you know how life is. You pass a law, and it doesn't do exactly what you thought it might do. So the law was expanded the following year, and in June of 2013, through the budget trailer bill, when the governor signed the budget trailer bill, there was more information sort of added to those sections of the law, and what it called for was that there be uniform reporting of the data, because what we saw was when regional centers reported the data, they each did it different. And so it was really hard to compare one regional center to the other because the data was sort of all over the place. So it called for them to compile in a uniform way, which helps people say, what's South Central doing? What's Orange County doing? And being able to really compare those in a way that made sense. It also called for the regional centers to post notice of the stakeholder meetings on their websites so that people could find out about the meeting and attend if they were interested. It also required them to send notice of that stakeholder meeting to local community groups that would be involved. So think in most regional centers, there are parent support groups around language and ethnically distinct communities, and they had to notify those communities as to when the meetings were so that those communities could be really informed of those meetings and attend. They also increased the kind of data that was reporting to include information on copays and coinsurance, because that was the same year that the law was changed so that regional center could fund copays and coinsurance. And the idea was, let's see if people are using this. So they were also required to report on that data. So then, not lots of stuff from that report still not implemented. So Disability Rights California went to Lou Correa and said, we're still seeing a lot of barriers for families, and one of the barriers that we saw was around language requirements. How can you participate in a meeting if the meeting's held in English and English is not the language that you speak, right? I mean, that you can't participate. How do you participate in an assessment for your child if the assessment is conducted in English and you don't speak English? And remember, we're using those meetings and those assessments to figure out what services children need. And so when we think about that gathering information stage, that's really vital to coming up with good services for children. And if all of that's being done in a way that families can't adequately participate, then we're really missing an opportunity. And so we worked with Senator Correa and came up with SB 555, which called for, in the Early Start program and under the Lanterman Act both, that meetings be conducted in people's native languages, and that documents be provided throughout the intake process to them in their native language, and that their IPP and IFSP be provided in their native language, so that people could really be accessing the system in their native language and participating in a way that for many families they were not able to because of the language barrier. And I think particularly, many of our monolingual families here in California, they tend to often be lower income, lower socioeconomic status generally, and so we were coupling problems on top of problems for them. And so accessing the regional center system in a better way takes one layer of that off for them. So this was really, it was really huge. As a lawyer, I actually believed that the law sort of required this, but I had to cobble together pieces of the law. After 555 was passed, the law is very clear. It's very clear. The exceptions to it are where it's clearly not feasible to utilize the preferred language. And there are some languages, particularly in certain parts of the state, that it would be very difficult for the regional center to find an interpreter that spoke that particular dialect. But when you think about sort of the big languages, that's pretty easy, you know, and especially in metropolitan areas. I mean, like I said, I'm from LA. There are some dialects that are hard to find even in LA, but when you're talking about sort of the big languages, Spanish, Korean, Chinese, you can do that for folks. But there was that exception where it was clearly not feasible to do so. So we're making good progress, right? We're coming along, but there's still work to be done. And that, we then went to Senator Lieu, and we talked with Senator Lieu about one of the problems that we saw, that we've, in our observations of working with clients, disproportionately affected underserved communities. And that was around what are called independent living skills services, ILS services. So, you know, think back. You're 18 years old, right? Who taught you how to cook? Who taught you how to make your bed? Who taught you how to lock the door when you came home? Who taught you to do your laundry, balance your checkbook? For a lot of us, our folks or our older siblings taught us that. And for some of us, we picked it up on our own. Oftentimes, people with intellectual and developmental disabilities, they're not gonna pick it up on their own. And they need to be taught in a very specialized way. So my mom took me out to the washing machine once and was like, you put a cup of this in, you press the button, you're done, right? I mean, it was not an advanced lesson. My mom was not really a housekeeper. So, and I was like, okay, I can do that. Cap, press, I'm good, right? Well, for people with intellectual disabilities, you may have to go over, cap, press, walk away 10 times, 20 times, 30 times, and then if they don't do it for 2 weeks, you start over again. That's how some people's brains work. So we need a service provider who can do that kind of specialized instruction, because let's be honest, as mom, I might be able to teach, the one-time step, but that really specialized instruction is going to come very differently. And so that's a service that's very common for folks. But many regional centers had policies that said you could only get ILS services if you lived in your own home or you had a plan to move out into your own home within 6 months. What I have observed is that, and this is a sweeping generalization, is that white families are more comfortable with their adult children moving out than families of color, particularly Latino families, who want their children to stay at home often until they get married. I mean, that's sort of very cultural, and many Asian cultures also sort of have this idea that you stay at home until you get married. And why would you move out? And so that rule was really disproportionately affecting the access to ILS services for people from underserved communities, because they weren't going to move out of their family home. Not in 6 months, not in a year, maybe not for 5 years, but they still needed to learn those skills. Because even if you live with mom and dad, if you're 25 years old, you know what? You need to make your bed, you need to do your laundry, you need to have a checkbook, right? And I would say many of us might be experiencing all of that a little more with the downturn in the economy and many adult children returning home. Right? Even our non-disabled children, when they come back home after college or after having a job for a couple years, they got to pull their own weight around here, right? So when we remember at the beginning, what did I talk about the Lanterman Act? We want independent, productive lives. Well, living an independent, productive life means you make your own bed, you balance your own checkbook, you cook some meals. But how do we teach people how to do that? They need these specialized services. And so working with Senator Lieu, we actually added language to the Lanterman Act that makes it very clear that you don't have to live in your own home to get ILS services, and you don't have to have a plan to move out. Anyone that needs independent living skills services has access to those, which I think is really important for communities of color, because that's a service that might be really useful to them. This also went to one of the things that we heard, particularly from regional centers around the data, is that the reason that regional centers spend so much more money on their white clients who are adult age than on their clients from underserved communities is because they're paying for residential placements. They're paying for things like group homes. And so if they're paying for a group home that costs $2,000 or $3,000 a month for a white client, and they're not paying for that, for their Latino clients, that's going to skew all of the numbers. And so, and one of the things that I said and continue to say is, okay, that's fine, and that could contribute to it, but then what are you doing for your families of color? Maybe they don't want their children to go live in group homes, but what do they need? What do they need to enhance their lives in the family home then? And are we offering that array of services that people really need? And so that was the idea with really clarifying this law. It was really to get to making sure that people need services that really are meaningful to them and helpful to them in their lives, and not sort of doing this cookie cutter approach of, when you turn 22, we offer you a group home, and if you don't want a group home, you get nothing. To really sort of broaden the pie of services. The other thing that has happened is the passage of SB 468, and that's the self-determination bill. Have any of you guys heard of self-determination? Okay, so a couple of you. So self-determination has not gotten started yet in California. We're still waiting on approval from the federal government. But what that's going to do is it's going to be an alternate service delivery program. So in the regional center system, remember, you get a service coordinator, you have an IPP, you develop goals. Regional center helps you use your generics, or they buy you services. In self-determination, you'll be given a pot of money. You come up with your goals and how to spend that money yourself. You use a financial management services company to pay the bills, but it really is you buying the things that you believe that you need. So, and you don't have to use regional center vendors. So let's say I need diapers, and I will tell you, in my profession, I spend a lot of time talking about adult diapers, which is sort of odd for a lawyer, but diapers are a big deal. And those of you with children over the age of 5 who wear diapers know diapers are a big deal. If you get diapers for your adult from the regional center, you have to use one of their vendored companies, which are typically durable medical companies. And you have very limited range of options of what diapers you can get from them. Under self-determination, you could say, I want X% of my budget to go to diapers, and I'm going to buy them at Costco or Kmart or wherever I like the diapers best. Even though those places are not vendored with the regional center, they don't have any contracts with the regional center, any of that. And so it really is a new model in terms of service delivery. And I think it's going to be interesting to see how this all plays out. And one of the thoughts is that when we look at underserved communities, it will give families more freedom to really think about, what do I need? What's helpful in my family? not sort of what services does Regional Center traditionally provide through their vendors, but what does my family need? So I think self-determination could be really interesting. Right, so she's asking really, how is it going to work in self-determination for families, particularly families who are maybe not as savvy about the system? How are we going to support families who might come from untraditional backgrounds to really do those creative ways and do that negotiating? And that's where I think it's going to be sort of interesting. And one of the ways that's going to happen is through what's called an independent facilitator. And so families under self-determination can have an independent facilitator. And that person can do a lot of that sort of creative thinking and negotiating. And this is where I think so I'm one of those, I know there are some people who, when I talk about disparities, they think that what I'm saying is I want to take stuff away from white people and give it to people of color. That is the opposite of what I'm saying. What I'm saying is I want to expand the pie for everybody. I want everyone to get the services and supports that they need to fulfill the mission of the Lanterman Act. That's what I want. And so it's how do we support people to do that? And I think whether people go into self-determination or not, as a community, we need to do a better job of educating people about their rights in general. So her question was, self-determination, this new model's coming, how are families going to know about it, and how would they even know if it's for them or not? And Steve and I were talking in the hall about this exact thing. And so a couple of things are going to happen. And luckily I talk fast, so we have more time to talk self-determination today. A couple of things are happening. One is, I know my clients' rights advocates are out in the community doing more parent training, and they're trying to sort of tack on a few minutes of self-determination, even at trainings on other topics, just to get people hearing about it. The other thing is that every regional center has what's called a local advisory committee. And it's comprised of people appointed by the local state council on developmental disabilities, which used to be called area boards. They appoint some people to the committee, the regional center appoints some people to the committee, and then the local client's rights advocate is on that committee also. And one of their big tasks is going to be coming up with an outreach strategy. And the Department of Developmental Services is also working on this, and they're currently making videos in multiple languages and closed captioning that include information about self-determination. But it's going to take a ton of outreach. The self-determination law is actually, I think, pretty well written in some regards. Some regards not so much, but some of them it is. And one of the ways that I think it was really well written is that it requires that this education piece take place everywhere and target rural communities, traditionally underserved communities. And what will happen in self-determination is when it goes into effect, when we get approval from the feds, because we want federal money, when it gets approved, it will start. And for the first 3 years of the program's going to be limited to 2,500 people. After 3 years, open to anyone who wants in it. But for those first 3 years, it's limited to 2,500 people. And those 2,500 slots across the state were prorated based on regional center size. So Alta is the second biggest regional center in the state. Alta got the second highest number of slots. West Side Regional Center is the fourth smallest. They got the fourth smallest number of slots. And then what's going to happen is that if you're interested, you think you want to do it, you're going to submit your name. The Department of Developmental Services is actually going to be doing the choosing for that initial 2,500. And what they're going to do is make sure that those people chosen to participate reflect the local community in terms of ethnicity, gender, disability, and living arrangement, and location. So in a catchment like Alta's here in Sacramento, remember this catchment has 10 counties. We have very urban Sacramento, but we also have very rural communities. Well, we don't want self-determination just to be people who live in Sacramento. It needs to encompass people that live in all 10 counties. We don't want it to be just for people with autism. People with cerebral palsy need to be part of it. People with epilepsy need to be part of it. And so DDS is going to ensure that those people in that initial 2,500 look like the community that they're coming from. And I think that was really smart. And part of why I think that was really smart is because what it does is it forces all of us to make sure that we're doing outreach to every community, that we're doing outreach to rural communities, that we're doing outreach to communities of color, because they have to balance those slots. So if we don't do any outreach to rural communities, nobody from rural communities applies, those slots can't get filled. So it really forces us to do the appropriate outreach, I think. Right, so what she's asking is, under self-determination, what kinds of checks and balances are going to be in play in terms of what services can be provided? Because the risk being that people could use that budget for services that at a minimum might be ineffective, and at a sort of worst case scenario actually be harmful. And I think we've all over the years seen a variety of fads, for lack of a better word, come into popularity and then fade out when they were proven to not be effective. And the law does talk about outcome-based. And so what will happen is, let's say I'm selected for self-determination. I'm going to have a person-centered plan. And the Lanterman Act actually talks about person-centered plans now, but I will tell you, in my experience, very few people actually have a true person-centered plan conducted, partly because those take a long time. Most IPPs are 40 minutes, maybe an hour. A true person-centered plan really should take half a day. And they're hard. They're emotionally hard. They're really thoughtful and require a lot of preparation and a lot of participation. And so it's really going to start with that person-centered plan and thinking about what are the goals, and not sort of the goals always like we think about IEP goals of he's going to learn to say 3 WH questions out of 7 trials, not that kind of a goal, but a goal like, really who does he want to be? Who does he want to be around? What kind of life does he want to live? And that's the stuff we think about. When I chose my husband, I really thought about what kind of mate do I want? What kind of life do I want to create? I did not choose someone who likes to live rurally, right? Because I don't want to live rurally. I like being in the city. So do you want to live in the city? Do you like hustle and bustle around you, or do you like quiet and calm? Do you want animals around you? Do you not? But really thinking about those bigger sort of questions and forming goals around those. And then, because then it becomes sort of, what skills do I need to develop to achieve those sort of big goals? And that skill development goes into those smaller 1-year kinds of goals. And so then when we think about outcomes, some of our goals, it's very easy to see outcomes. Maybe I want to, over the course, eventually I want to live in my own place. And so what do I need to learn how to do? I need to learn how to clean house. I think, what's the outcome there is I learned how to clean house. And so then when we come back to it a year later, what outcomes did we achieve, and can we see that? The other sort of limitation on services is that they have to qualify for federal funding. I will tell you, though, there are some, it's interesting because the community, and this is a joy of having a program that hasn't started yet. There are some folks in the community who are very concerned about that requirement, and they say, oh, nothing good is going to be able to be funded, because of that requirement. And there are some things that are really creative that may not be. But I will tell you, I think a lot of stuff can be if you're sort of creative about it. Where I think families it's going to be really important that families, to avoid those sort of predatory schemes, I think families are going to have to be really thoughtful about how am I going to measure success and how long am I going to give someone to demonstrate success. Whether that's someone who says that a hyperbaric chamber works, or whether that's someone that says they can teach my child to clean house. And one of the things that I think is really good about self-determination is the flexibility to change services. So if I hire someone to help teach my child how to clean house, and you know what, I don't like them, or it's not working, or my child doesn't get along with them, I fire them. And I hire someone else next week. And it really is sort of that quick. And that speed and flexibility is really difficult in the current regional center system, where if a provider's not working out, you have to call your service coordinator. You have to get a hold of her because she's out in the field meeting with people, so you have to get a hold of her. Then you have to explain, and then she may tell you some strategies to try and work it out, and then you try those, and then everyone decides this just isn't working, but then she's got to do all the paperwork to end that, and then she's got to find another vendor for you, which might entail her sending out vendor packets before they will agree to work with you, and then someone has to agree to work with you, and then she has to do more paperwork. I will tell you, I have heard stories from families over the years. Changing respite providers can take 4 months. In the meantime, you're either not being served or not being adequately served. Self-determination, literally, you are not working for my family, bye-bye, thank you. That was Thursday, Monday, I've got someone new in my house. It really increases that flexibility. And so I think one of the things that families need to really do under self-determination is think about, if you've told me you've got some magic bullet that can make my child talk, okay, I'll try it. I'll give you 3 months. I want some results. And what do those results look like? And it could be very different than sort of how we measure results in our traditional system. In the traditional system, there are a lot of reports that go to regional center. And honestly, vendors are being paid to write those reports. And I think sometimes those reports are really helpful, but I think for other families, those reports are not that helpful. And so in self-determination, a family would decide, do I want quarterly reports? Do I not? How am I going to monitor these outcomes? What does that look like for my family? Maybe I want a written report, maybe I don't. Maybe I want a meeting every month where we go over what's been achieved in that month. And so it can look very different, and you can negotiate the rate of pay and what that would look like. So I think there's going to be a lot of responsibility on families to look to those outcomes. The other piece of it is people who provide what's considered direct care have to go through a background check practice. They will have to be background checked. So independent facilitators, that payment will come out of the individual budget. And I've heard sort of different. And once again, joy of a program that hasn't started is some people are like, oh my gosh, that's going to cost too much. You're not going to have any money left to buy services. And then what we found, we actually did a pilot program in self-determination here in California with 5 regional centers. And all of I shouldn't say all, when studies were conducted as follow-up to those programs, the cost went down under self-determination. People spent less because of things like being able to negotiate, being able to buy your diapers at Costco instead of through the durable medical equipment company. You spent less on diapers. And so I think, and sort of the general idea is that because people will be able to negotiate and spend less on some services, that they would have enough sort of money in their budget to fund the independent facilitator and the financial management services company. So what she's asking is, in the LA Times article in December of 2011, when they got the data from the Department of Developmental Services, children with autism aged 3 to 6, South Central was spending a little under $2,000. Orange County was spending about $18,000. How does that happen, right? And what did South Central say about that? And so at the hearing in April of 2012, South Central was actually asked by members of the legislature, how do you explain this? And they can tell you better than I can tell you, because I've got my own viewpoint on things. What they said was, we give people what they need, and this is all people have indicated that they needed. Because remember, this is an entitlement system, so if you need it, you get it. And I think that is true to a certain degree. And this is where, and if you look at the other laws that have come, and I've got a list of things I'd like to get passed, you guys can imagine. People only can ask for what they know, right? So if I don't speak English, if I maybe have very limited education myself, if I don't have access to quality health care, and then I have a child with autism, how do I know what services I should be asking for? I mean, if I don't have access to good quality health care, my pediatrician's not suggesting that I ask for things. In fact, when you look at diagnosis rates for autism for children of color, they're diagnosed significantly later than white children. I mean, like 4 and 5 years later. So pediatricians in those communities are not identifying the disability. So they're certainly not identifying services to remediate the disability. If I have very limited education myself, how do I do research and gather information? I mean, I will tell you, a lot of the families that I work with, mom and dad have 3rd and 4th grade educations. So they're not gonna go on the internet and start Googling services for a child with autism. So they don't know, and so they can't ask. So I do think to some degree, I think South Central was right. They were giving people what they ask for. But that's where our system has fallen apart. And we need to do a better job of educating people. And I think with or without self-determination, we need to do a better job of that. So she asked for children, for school-age children. They're getting services from their local school district. How does that intersect? And I'm actually going to broaden her question. She said, how would that intersect with self-determination? And I'm going to actually broaden it to how does that intersect with regional center? So to get services from the regional center, you have to, under the law, utilize what are called generic services. Special education services are a generic service. So if I have educational needs, those needs should be being met by my local school district. If I have medical needs, those should be being met by my health insurance plan or my Medi-Cal plan or what have you. Generics, the things that people without a disability would use, right? Our non-disabled children, where do they get educated? Public school system. Where regional center comes in is to provide services that are not available from generics, or services that are like disability related and therefore sort of outside of the scope of generics. So think about daycare. If I have a 6-year-old who needs to go to daycare because I work outside the home, I'm going to call my local KinderCare. I'm going to say, hi, I'd like to enroll my 6-year-old. He's going to be there from 3 to 6 every day. And they'll say, great, we're going to charge you $500 a week. And I'll say, okay. Well, now let's say that I have a 6-year-old who has a disability and still wears diapers. So when I call KinderCare, I'm going to say he still wears diapers, and they'll say, okay, we'll take him, but we're not going to charge you $500 a week. We're going to charge you $750 because we have to pay a diaper stipend. These are the things you learn when you're a preschool teacher. You get an extra 50 cents an hour to change diapers. You have to pay a diaper stipend, right? It's called distasteful duty. That's the name of the stipend. So most employers pay you more if you have to change diapers. So KinderCare is going to charge you more. Well, him wearing diapers is because of his disability. So why do I have to pay more because my child has a disability? Regional Center can come in and pay that difference. The difference between $500 a month for daycare for my non-disabled child and the $750 a month because of the disability. Regional Center can pay that difference, the $250 difference. So that's a really good use. There may be other services that are just not available from anyone. We may need in-home behavior therapy, and the school district's like, I don't care how you guys do at home, right? They care how little Johnny does at school. Yeah, figure it out at home. Regional Center should be picking up your in-home stuff. Think about respite. Caring for a child with a disability is really exhausting physically and emotionally, and you need a break from that. And so you need respite. That's a Regional Center service. Social skills training. How do I teach little Johnny to go to Target? I mean, let's be honest, going to Target is an important part of people's lives, right? And anyone who has tried to take a child with a disability to Target knows how important learning how to act at Target is, right? Well, is the school district going to do that? No, the school district wants you to access your educational curriculum. They don't actually care if you can go to Target. Maybe when you're a transition age student, 16 and up, maybe then they care about if you can go to Target. But when you're 8, school district doesn't care if you can go to Target when you're 8 years old. But as a mom, I care if little Johnny can go to Target, right? So I need someone to work with little Johnny and I to figure out how I can get him into Target and get some shopping done and get him out of Target. Well, who's going to provide those services? Regional Center is. And we used to get, before 2009, some other services that were really helpful to families, and they included social recreation, things like swimming class, karate class, those sort of integrated social models. Like my gym, places like that, the social recreation. And in 2009, in the budget cuts, we lost those, except under very limited exceptions. Camp. There were a number of camps all across California where children and adults with developmental disabilities would go to camp, much like some of us went to 6th grade camp. You do all the regular camp activities, right? They're camp. And those were really good because for a lot of families, it was a break for the parents, but it also had enabled the person with a disability, whether they were children or adults, to go be in this very normalized environment but that was really structured to their needs and abilities. And I had some adult clients who had gone to the same camp for many, many years, and every year they would get to see their friends again from all over the state and reunite and have those relationships. But we lost camp. I will tell you, under self-determination, you can purchase those things again, which is one of the appeals of self-determination for a lot of families. But when I think about disparity, I actually think those types of services disproportionately affected families of color and families from underserved communities, because when you think about sort of what do families need, if your child goes and lives in a group home, him going to camp might not be as important as if your 30-year-old child lives with you. Camp might be much more important if your child's living with you, because that's a very social time for him to be with his friends and in that different environment. If he lives in a group home, he's getting some social component because he may have peers that live in his group home with him. And so I think that those services, and one of the things that I'm pushing for is to bring back those services, and honestly, I'm pushing for it as a way to reduce disparity in purchase of services. So we'll see how far I get, but so that's how, when you have what you consider to be a dual eligible child school district regional center, how those systems can interact. So she was talking about how for lots of families, it's really overwhelming. The fight to access the system is really overwhelming because they're constantly having to go up against things. And outreach and education is one piece of it, but I think that there's this other piece of changing the system and making things more approachable. So I am quickly going to let that segue us into this year's laws. So this year in the trailer bill, we actually got more good stuff passed, because I'm always at work, you guys. Small, baby steps, but we're getting there. So this year, remember earlier today when I said your IPP you leave with a copy in your hand, but your IPP you don't? You do now. You didn't in 2012, you do today. So as of June 27th of this year, so 6 weeks ago, the law requires that if you want it, you have to get a handwritten copy of your IPP. And by handwritten, I mean typed or whatever, paper. Something you can hold in your hand, your IPP, in your preferred language. And it's not your preferred language, in the threshold languages of the community. And so it's in 45 days. I mean, you guys, I don't get to just write laws. I mean, I do have to compromise with folks, so I don't get everything I want. But we got that passed into law, so it's very clear that people get something to hold in their hands, in their language, so that they know what does my IPP say? What goals am I working on? What services am I going to be getting? We also got in the law that DDS is actually going to form a stakeholder committee to look at equity and diversity issues, not just that task force that met a couple times and issued a report, but an actual stakeholder group to look at best practices. And then each regional center, in their performance contracts with the department, they actually have to have objectives to monitor their progress on reducing disparities. And one of my goals with the stakeholder group through the department is to really come up with some real best practices, because I think this is hard. I mean, it really is hard. But I think we've got people doing good work out there, particularly I think in the healthcare arena I know I've joined some webinars lately that really talked about some interesting strategies of how to increase access to healthcare services for people from underserved communities. And so really looking at what are we learning and how can we implement it into our system. Some of the regional centers have done some really amazing work. Lanterman Regional Center has, and I try to only name names when I'm pleased with people, so I'm telling you which regional center. They have what's called the Promodoro program, and it's proven to be extremely successful. And what it is they take their families, their Latino families, who are really struggling, and they don't give them a traditional case manager. They're actually contracting for a special case manager from the Promodoro program. And they have very low caseloads. So in regional center right now, the law says that you should have a caseload no larger than 62 cases. I will tell you, every regional center, all of them, all 21 are out of compliance with the law. When I talk to regional center EDs, they tell me caseloads are at about 90. So you have one caseworker working with 90 families. The Promodoros have 2 or 3 cases, so they can devote their attention to these families. And what they have found is that a lot of these families need really that hand-holding of like literally helping mom call and make an appointment with the doctor, and then riding the bus with mom to get to the doctor, and what to say at the doctor appointment. And when the doctor sort of blows you off, how do you bring the doctor back to answer my questions? And for a lot of them, and remember, Lanterman Regional Center is in really the heart of Los Angeles County. They have their catchment area has what in LA is considered to be Koreatown, Thai Town, Little Armenia. I mean, very ethnically distinct communities, and you have this level of service that is very different. And it's proven to be extremely successful. Families are much better able to access services that are available to them. They're working with providers. A lot of providers, if you live in a converted garage, providers might not want to come do behavior training. And so they're working with providers to ensure that providers will come to some of those neighborhoods. And so the Promodoro program, they've had one family who has not sort of proven to be successful, and they've been doing it for 2 years, and I want to say they've had 50-something families go through the program. So if we know what's working, how can we replicate that in other regional centers and other parts of the state? And so it's that I think that the stakeholder group on best practices could be really good, because there is some good stuff out there, but we need to pull it together and be able to replicate it. And I think if we start doing a better job of figuring out what support people need, we can do that for them, and their frustration will go down, and it's not going to be so much of a fight. It's honestly, folks, it's always going to be a fight if you have a child with a disability. I'm not going to sugarcoat it. It is. But if we can reduce the amount of fight and make it a doable fight, then I think we're pretty successful. Right, so she's saying, what do we do? There just aren't enough bilingual providers. And that's where we did get written into the law that in RFPs, so a request for proposal, when a regional center wants new vendors, they send out a request for proposals, and then the community responds. And those RFPs have to address cultural and linguistic capabilities, and the goal is that then you're actively recruiting more vendors with linguistic and cultural capabilities. And I will tell you, I mean, for my own organization, it's a challenge. You know, I have 55 employees, more than half of my staff are bilingual. It's not enough. I mean, honestly, it's not enough. In an ideal world, 100% of my staff would be bilingual, and that would not include my bad college French. So, I think, once again, baby steps. I actually think that goes to a larger issue of we need to do better jobs in our professional schools of recruiting people of color. I mean, like, for example, law school. There are more women than men in law school. We've done a really good job of recruiting women into the legal profession. We have not done a great job of recruiting women of color into the legal profession. So I think that's a bigger system problem than just our little system. But it doesn't mean we don't need to do it. I think we also need better training for particularly our medical practitioners around developmental disabilities. We still need that. So, and I apologize for not being more clear. Her question is self-determination. The 3-year, it's limited to 2,500 people, then what happens? After 3 years, it's open to anyone that wants to participate that's over the age of 3 and lives in the community or plans to live in the community, and we use community very broadly. You don't have to choose self-determination, though. So it really is gonna be in 2020, if I've got a 5-year-old with a disability, I get to choose what kind of a service delivery system do I want. The other thing is maybe I choose self-determination and 3 months into it, I'm like, this is too much work. Oh my gosh, I want a case manager, I want somebody to find my service providers, I'm out. You can exit the program at any time because it's voluntary. The only sort of restriction is that you would then have to wait 12 months to go back in. And the reason that they did that is they don't want to create a system of like, I'm in, I'm out, I'm in, I'm out. Partly because the budgeting gets kind of funky. The other thing is, so if I'm in self-determination and I'm a Regional Center of the East Bay client, but my family moves, and now I'm a North Bay Regional Center client, I'm still in self-determination, my budget moves with me. She asked, do I have a sense of budget? So your budget is based on your services received. Notice I chose that word very carefully, and I enunciated it because it was important, which is hard to tell in my echo. It's based on the services you received in the last 12 months. So the other thing that came in the data is how many regional center clients receive zero services. I am shocked. I was gonna say I'm using that word too easily. I'm not using it too easily. I find it hard to believe that there is a person with a disability whose needs are being met so completely by their generic service agencies that they needed nothing from the regional center. I have never met that person, and I've been doing this for 15 years. I was an EI teacher before that. I have never met that person. But I will tell you statistically, there are a whole bunch of them at every single regional center. And so, but in self-determination, they'll look at the services you received, not the services that were authorized for you, the services you used. So what I'm telling folks is if you got 30 hours of respite authorized, but you used 20, no, start using 30. You use every dime of your services if you think you're gonna go into self-determination to make sure that your budget is really as high as it should be. Well, so Steve's reminding me, this is why, remember, we're a community, people have to remind me. There are times in our life where we have more generics available. School-age kids have special education, but when I'm 22, I exit the public school system. That's a generic who might have been meeting a lot of my needs that's no longer available to me. And so when we're looking at a budget, the budget that I had when I was in public school is going to look very different than the budget that I need now as a more independent adult. And so we can reevaluate it. Your budget can also be reevaluated if something changes in my life. You know, maybe I was diagnosed with another disorder, or maybe my family moved, and or my parents got divorced, or whatever happened in my life. If there's something in your life where you need your budget to be reevaluated, you can do that. So she's on her local advisory committee at Central Valley Regional Center for Self-Determination, and one of the things that they came up with as an outreach methodology is to literally make contact with all of those people who receive zero services, because self-determination may be a really innovative way for them to get the services that are important to them that they may have felt were not really available through the traditional system. So I think that's a phenomenal use of a new program. I will tell you, Far Northern Regional Center, their executive director, Laura Larson, was pretty shocked by the number of early start, so our 0 to 3 children who were either not receiving very many services or were high underutilizers, which means they were authorized services, but then when you look at how many they used, it was much lower. And she actually worked with her early start service coordinators to literally call those families and say, how come you're not using your services? Is it the wrong service? Do you need transportation? Talk to me about what we can do, because we authorized those services because we thought you needed them. So what's going on? And for a lot of families, particularly in rural areas, transportation is a barrier. And think about if you've got a toddler, particularly a toddler with a disability, and you're having to access limited public transportation in rural areas, you might have speech therapy authorized, but if it takes you a 2-hour bus ride, and then you go to therapy for an hour, and then you have to wait 2 hours for the next bus to come, and you're doing all of that with a 2.5-year-old, woo, I cannot actually think of a worse day. That is not a good day. And so people just don't go to the speech therapy. That's what happens in real life. When there are that many barriers to accessing a service, you just don't go. And so because Far Northern is such a small regional center, she was really able to literally reach out to those individuals and help them overcome those barriers. And that's the kind of thing where I think system-wide we need to do better. So even in a regional center like Inland, which is our biggest regional center with almost 30,000 clients, I think we need to devote those kinds of resources to working with our community and figuring out what those barriers are so that we can overcome them.
The UC Davis Mind Institute was created in 1998 with a promise to find cures for neurodevelopmental disorders. Every day, our physicians and researchers come closer to fulfilling that promise. Their groundbreaking research on autism, Fragile X syndrome, chromosome 22q11.2 deletion syndrome, ADHD, and other brain disorders are helping children achieve their fullest potential. Please visit our website to find out more about current studies, upcoming events, and how you can help make a difference.